with a very good score, very good, but there was just a part of me that felt I wasn't good enough for the class. I was feeling so withdrawn, such that it was beginning to affect my grades. And I think one of the things that helped me was being able to have friends around that could motivate me, that we could talk together. Friends that made me understand that the challenges of school was not just faced by only me, was not just experienced the way I was experiencing it, not exactly, but the way I was able to understand that every one of us have the different issues that we are facing. So the role of supportive network, especially in our campus and out of our campus, cannot be overemphasized. And one thing that supportive network can also do for us is that it open our eyes to the world around us. Peer-to-peer conversations, talking with your friends helps you understand that the academic environment is not just about schooling, book, and all of that alone. You tend to understand that there's a social program there, there's another opportunity for volunteering there, there's another social impact program there that you could attend. And that is one thing that helped me through my journey in school. So, not just in our schools, it's also important for us to build network outside of our circle, because sometimes the people around you might not be that supportive enough for you, because they are seeing you every day. They feel outside of your immediate environment is so important, because when you talk to people often, I think people that are not seeing you every day tend to care for you more than people that you are seeing every day because of familiarity. So for me, I've also been able to build network outside of my university, such that there's a social impact program. Let's say, for example, in Ibadan now, I know that my friend in medical school in Lagos is also coming to Ibadan. We know that, okay, when I get to Ibadan, I want to go to Ibadan because I will see my friend coming from Lagos, and also go to Abuja because I will see my friend coming from Kano. So such an intervention can also help us to build that mental resilience, to help us to diversify our schooling, such that we're able to cope with hope in mind. You know, when there is hopelessness is when many of these mental breakdown happen. But when you cope with hope that, okay, I'll see my friend, I'll do something exciting, I'm going to go for this activity, you know, academic environment packed full with some little spice is one thing that can help us to dampen the effect of the rigors of our academics. And also for I think the first question about the being overwhelmed, I tell you, the truth is that we ourselves, we get overwhelmed, especially when you are dealing with a person. Let's say you have a friend that is coming and coming, okay, I'm depressed today, tomorrow I'm feeling down, next tomorrow I want to kill myself. Sometimes you get overwhelmed also. But I think one of the things that can help us is also seeking professional support for ourselves. And also, if you know that you have this kind of advocacy role, and then you are also having to interface with people who are having mental health breakdowns, you could also go online, go watch some videos. I think those were the things that I did to help some of my friends then. They asked me questions that I could not answer. I get overwhelmed by their constant comments, such that I don't even know what is wrong with them. Sometimes I refer them to clinical psychologists or psychiatrists, and sometimes I tend to go online, go
The academic environment, the academic environment poses at us. So, emotional intelligence is different from the normal intelligence quotient. It's the ability to know, to be aware of the kind of person you are. You know when you are feeling bad. You know when you are hungry. You know when you are supposed to show empathy to others. Emotional intelligence goes emotional intelligence goes beyond you. It's about the other person and not necessarily you. And not necessarily you. You are able to actually picture not only what is happening to you, but to what is happening to others. So as you are trying to navigate through these difficult times, you should be aware of yourself, what you are going through. what you are going through. For instance, let's say there is a difficulty, or maybe somebody failed an exam or in course. There are different ways we can go about it. For instance, there is what we call adaptive coping skill, and there is what we call maladaptive coping skill. One of them is to what? To seek help. You seek help, and you are able to realize that there are others too that may also need that help. That is where emotional intelligence comes in. Is either you seek help, you confront the problem, you look around and get in touch with people who have done what? Have that experience in the past. Is that okay? Not maladaptive way. Some people go into what? Alcohol and other substances to cope. Why some people also begin to what? Inflict injury on themselves. I once saw one of the students who she was really, really overwhelmed with academic problems. And the next thing she could do to ease herself is to be cutting herself. Said whenever she does that, there is a kind of relief that she has. And I was telling her that that is what? A maladaptive way of coping. So somebody said he should see a mental health physician or professional that can really, really what? Help out. So emotional intelligence will inform you that you are not the only one passing through this. There are many people in the past, even in your current class, there are people that are also having similar experiences. So building resilience is important, and we can do that by having a group of friends, connecting with people, sharing our thoughts, and looking for the best way to go about it. So bringing both issues together will actually make us to be well equipped for whatever challenge we face as college students. WHO said that the leading cause of death among young persons, college students, is suicide between 15 and 29 years. And I know majority of us fall within this age bracket. So building the resilience and emotional intelligence is very important. Thank you.
Thank you very much, sir. Please, a round of applause for him. Dr. Ogobi, I would like to ask you this question. And the question is that, what role do school administrators, mental health professionals, and even the government, what role do they play in creating a supportive environment that reduces the risk of suicide? Sorry. Because we have a lot of questions here. There is even one that says that the current Nigerian situation is one of the main sources of suicidal ideation. And that's where government comes in. Because of the economy, people are prone to, think about suicide and all of that. And even the question here is saying, how do you navigate medical school without adequate financial support? All of this can be traced back to the difficult economic situation that we are in. So what roles do school administrators, mental health professionals, and government play in reducing the risks of people attempting suicide, sir?
That is an interesting question. What role do they play? But I think the question is, what role should they play?
Yeah.
That question will be difficult to answer because the government, the school administration, they have their priorities. And if you look at the Maslow hierarchy of needs, you realize that self-actualization is quite very high. So if you don't have the basic needs, how is it possible to go to self-esteem and self-actualization, which is where, your mood, being suicidal or not being suicidal, will be addressed? So maybe in a country where we are even struggling to eat, we are struggling to have accommodation for people, we are struggling for the most basic of needs, it may be a challenge for the government or the school administration to go beyond providing that level of service. But be that as it may, they cannot completely ignore the problem. And if they cannot completely ignore the problem, at least maybe the first step is to create an environment where the problem can be identified and then intervention can be delivered. In most institutions, like I work in Bowen University, we have a student affairs unit. And I believe in your institution too, there will be a student affairs unit. But the question I usually have is, what is the staffing of that student affairs unit? The people in the student affairs unit many times, and I've had reason to question that arrangement. Academicians are usually in charge of the student affairs unit. And academicians, I always ask, because in an average company, the HR, the people who man the HR are not the core professionals in that industry. So why is it that in the industry of academics, in the educational industry, it is believed that an academician is the right person to man that department, when in fact I will believe that somebody who understands human behavior, even if it's an academic, but at least someone in the humanities or social sciences, may be in a better position than just a professor of mathematics or a professor of soil science or any of these courses that may not have any relationship with handling humans. So that is one thing the school administration can do. Put the right people in the right position so that they can identify the problem. Now, for the mental health professionals, one, I'm sure you are aware that there is a serious scarcity of mental health professionals. So it's not likely that mental health professionals will also come and intervene in the schools. But part of what we can do is what we are doing now, advocacy, and giving information, as Professor Akisulire said, providing the right information. When the people who have the responsibility have the right information, then they can, make the right decisions. But it's going to be impossible for us to make the decisions for them. One thing that I don't know if it is government that can help or is a cultural problem, because it's more of a cultural problem. My observation, and I'm going to piggyback on the issue of emotional intelligence. When we are talking about emotional intelligence, there is intrapersonal intelligence and interpersonal intelligence, which is married together for emotional intelligence. There is a problem with our educational system in that our educational system completely deprives us or does not encourage intrapersonal intelligence. It doesn't teach us to look inward and then know where our strengths are, where our weaknesses are, to decide what path we are going to take. One of the causes of stress, for instance, I will use my own example. In primary school, secondary school was extremely easy for me. I didn't need to read to pass. So, when you have that level of ability, then it was assumed you should be a doctor. And I got into medical school. 100 level was a breeze. 200 level was when I then faced resistance for the first time in my life. And at the point of resistance, it then occurred to me that I don't want to be here. Why am I stressing myself for something I don't want to be? So you can see there's already a conflict. And there's a fertile environment for psychological stress and, any of the other sequelae. Fortunately for me, in University of Lagos where I trained, you start with your mental health at very early. So we had our first medical psychology in 300 level. So I found my calling in 300 level. But for most other schools, before you even know anything about mental health, you're in 500 level, 600 level. So you suffer through the whole stress without knowing what is going on before you are then exposed to, what mental health is and, some of the coping skills you learn later in your career. Now, that's why I said, is it a cultural thing? If there was a way for people to enter courses that are easier for them based on their own strengths, some of these stresses will not be there.
Yes, sir.
It's not all of you in medical school that are supposed to be doctors. Unfortunately, you have started. You cannot give up halfway. That's also not good. So then also the economy. if you go and do art, which is your passion, you may not be able to feed your family. So it's intertwined. So to be honest, it's difficult to recommend because the problem is the problem seems to have too many, there are too many moving targets that is difficult to, it's difficult for me to recommend. Let me just put it that way.
Thank you very much, sir. Please, a round of applause for him. Hope we are taking notes of these things. Don't worry, we'll soon be done. Miss Eunice, please, we'd like you to share with us some practical coping strategies as a student yourself. Like, I want to learn from you. Everybody here wants to learn. Practical coping strategies that they can use to navigate moments of extreme stress, anxiety, or depression. Like, somebody's in that particular situation, and you were there to help the person. What are the practical steps you recommend that, oh, do this, do this, do this? Because a lot of people have that question. Somebody that already has suicidal thoughts, what do I tell them particularly? How do I make sure I come through for them? Those practical steps, we'd like to hear from you.
All right, first of all, I would like to say that whatever I would say would be my coping mechanism and some things that you can apply. These things are relative to individuals. And the first thing I'd like to say is know yourself, really. Know your threshold, especially in medical school. Know what triggers you. Know what tips you off. Know when, because the truth is there's always a warning sign in your head. You know when you are withdrawing or when it seems like things are getting too much for you. Personally, there are some of my classmates that they take some days off from postings, from class. Personally, I'm not freely able to because I'm the class rep. And I know that I would need to be there. The lecturers would say, oh, where is this? Where is this person? And I struggled with it for a while because I felt like everybody was looking up to me to perform. And then I was also dealing with my own personal issues. I had to speak to myself that, Eunice, if you die today or if you give up today, they will pick another class rep. They will pick somebody else to take your position. Somebody else will do the work. I had to tell myself to take a break. So there are some days that I have an assistant. The days that I cannot show up, I am completely gone. I take a break. And taking a break is not even the main thing. What do you do during that break? It's possible that I used to overthink a lot. So it's possible I'm taking a break and I'm still thinking about the whole problems of the whole world. That is not a break. If I'm taking a break, it's either I'm watching a K-drama, I'm watching a cooking show. I'm just doing something that relaxes my mind and takes my mind off the stress. Sometimes I may even switch off my phone because it's possible that I'm taking a break and somebody's calling me, oh, so needs this, a lecturer needs this, I need to do something. But I make sure rather that I shut down completely. Also, another thing you can do is look for outlets. What I mean by outlets, if you see that you are heating up, if your phone is heating up, they'll tell you drop it, maybe put it on an AC or something like that. So look for outlets. If it is going out with friends, just sit down, discuss, eat. Don't stress eat, because sometimes we fall into the extremes of stress eating. That's also a maladaptive behavior. But go out or be alone in your room. Pray if you need to. Speak to God if you need to. But just know what works for you and don't be in a competition with everybody. I have a classmate that when we're done with a posting and we're moving to another posting, she's already reading for the next posting. Let's say we write exams on Friday. She's already preparing herself for the next posting by Friday. And I'm like, I can't do this. This is not me. So learn not to compete with people. Really, it all boils down to knowing yourself, know what triggers you, and please speak up. It's a very practical thing. I know speaking up is now sounding like a cliche thing. When they say speak up, you are not alone. It really helps. It really helps. During my part-time farm, that was one of the darkest moments in my medical life so far. I had to learn how to speak up, not just to my friends, to my parents. And I know there's a fear of, oh, my parents have paid millions. How will they feel if I failed a course? In fact, I failed pharmacology in one of my EOPs, and I was the only person in the whole class of 69 who failed. I was a class rep, so I was already thinking, lecturers say, how would this girl fail this? My friends are also looking up to me, oh, what happened? Pharmacology, how could you fail it? I was already shutting down. I had to cry out to my mom, and thankfully, she gave the right support. So please, speak up. Let them know what exactly you're going through. And speak up to people that would not judge you. And if you're the one they are speaking up to, please, it's very important that you are sensitive. Sometimes when people are speaking to you, that's not the time to start advising them. They need people to listen. Just listen and empathize. It's not the time to start giving your own advice. So know when to speak, know when to be silent. So I think some of these are.
Thank you very much. A round of applause for her, Dr. Faith. Thank you. So listen, don't judge. I think that's a campaign on Twitter. We don't listen, we don't judge. Don't just say that statement, act it. Listen, and then from there you can refer the person to a mental health professional to access help. That's for anybody that is having, you notice that they're having suicidal thoughts and then they need help. So Dr. Faith, quickly, this is the last question here before we just go through questions that were asked by the audience. We've learned today that like technology, use of phones, going to Instagram, seeing people, and then you want to be like them and all of that. There's a way it contributes to this problem. Like as a student, how do I take note of this, and what are measures that I can put in place to make sure that it does not affect or contribute to this particular problem?
Thank you so much for that question. I think I've been affected by that as a person, and it was later I found out that there's something actually called LinkedIn depression. I don't know if any one of us here is on LinkedIn. I think there was a time when I was in 400 level, I saw a 22-year-old lady who studied, I can't remember now, who studied one course and then got two PhDs. I think the funding was around $250,000. And then when it was converted to Naira, then it was like, I think 1 billion or 2 billion or something like that. So I started looking at my life like, why did I even study medicine? If I had not studied medicine, maybe I would have been done now and also maybe apply to this. What is this person doing differently that I can't do? Even the mental prowess that I possess to study medicine, I'm not sure this person has this type of ability. And then I scrolled down, looked around and all of that. And every day when I'm opening my LinkedIn, I come back with depression. Every day coming back, I'm sad. I'm drawn away from my friends. I feel like I'm not on the right track. Over and over again, such that it started to affect my going to school, started to affect the way I see medicine, started to affect the psychology of coming to school and thinking that, oh, I'm going to become a doctor one day. I started feeling like it was worthless. And one thing I did for myself was to take a break. I think for a long time, I think 1, 2, 3 months, I cut off my LinkedIn totally. I stopped going there until I was able to develop mental resilience, to be able to understand that, oh, these persons and myself, we are not the same. Okay, the path that I've chosen also, I could make something substantial out of it. Oh, and it's not compulsory I follow the normal route of, oh, everybody wants to become a doctor and you have to specialize and you have to practice, you have to do your fellowship. It's not compulsory I go through that route. Oh, I also was able to tell myself that there's no time that is too late. I can still reroute. No matter the stage that I get to in life, I can still reroute. I can still take up opportunities that meet my interest. And these were the things that I did that helped me to be able to cope with those inferiority complex that I had to seeing people online. So many of us, we go on TikTok, we have that celebrity crush. We have that celebrity model that we want to be like. I want to be like this person, I want to be like that person. And we are trying to match up. I want to tell you to hone your race and run your race. Owning your race, you know that this life, it is yours. If anything happens to you today, it happens to you, not them. And run your race such that you are not, I think there's a Yoruba proverb that says, Ma wa go, Allah go, shisha, or something like that. Don't look at another person's watch Don't run in another person's timing. Your own timing is perfect for you. Where you are is perfect for you. And when the time is right also, God will also take you to that position that you need to be. So those were the things that helped me, and I feel it will help us also. Thank you.
Thank you very much. A round of applause for him. So we have 2 questions left. We're almost done. So, Dr. Okpadala, I'm going to ask you 3 questions in one. So, this person is asking, what's the best way to tackle most mental health cases for people that are in shackle poverty? Because I've heard something from somebody. They said everybody is fine. They just need money. That if you give somebody money, most of their problems will be solved. So, and the person is also asking that how can they mentor a person who is already in the depth of suicide? And she's saying at times I do think of having a suicidal plan due to academic pressure. How do I conquer these thoughts? And to add to that, somebody also asked that, how do I stop overthinking? So we just want a very short answer in 2 minutes, sir.
The first question, what's the best ways of to tackle most mental health issues, especially in people who are in poverty, so to say? The problem of poverty or lack is not peculiar to just a singular person. It's a universal problem. And some people who are in abject poverty, many of them are still striving and are still optimistic that one day they will be out of what? Poverty. Àwọn Yorùbá máa ń pòwe kan pé wọ́n ní ìran mélòó kan kò kí ń tòṣì. So determination at times will make people to strive not to repeat maybe the family history of poverty. So it's not absolute that when you are in abject poverty, you are more likely to have mental health conditions. But for people who do not have the means to seek for help, that does not mean that they shouldn't seek for help first. And there are several mental health NGOs that one can actually do what? Approach in this regard. And what we do most of the time when patient comes to us and they have financial problems, we involve social workers. These people will ensure that whoever they needed to what? To contact, there will be a support system to them in terms of finance. They will get across to that person. And that's the reason why in psychiatry, we don't work, solely. We work as a team. We have psychologists, we have nurses, and we have social workers. They will look into it and look for ways to navigate the issue of finance. So not having money should not be an impediment to seeking help. So when you come to the hospital or you see a mental health professional, with the help of social worker, they can actually raise funds to take care of that person and mobilize help. The second question, how can I mentor a person who is in the depth of suicide? You can't mentor people in suicide. How can you help? How can you help people in such a situation? Is what we have been saying all this while. Like the first speaker, the keynote speaker said in the morning, you need to ask them, discuss with them, don't judge them, don't criticize them. All you need to do, depending on the intent of their plan. For some people, they are just in maybe ideation phase. But people who that suicide is imminent in this kind of person, you need to stay with him or her, ensure that the environment is safe and is rid of lethal substances, any weapon whatsoever, and you try to get help for that person. That's the best way to help. You don't really need to mentor. At times I do think of having a suicidal plan. You know what? This person, if you are having incessant thought of suicide, it's time for you to seek what? Professional help. That is what I would say. Yeah? Overthinking. Well, maybe you will need to see us, but there are methods, measures you can use to actually distract yourself from this. There are activities you can engage in that will serve as what? A distraction to whatever you are thinking about. And we also need to dig deep into what that person is really thinking about.
All right.
So it's a whole lot.
Thank you
That
so much,
person
sir.
can-
Please, a round of applause for him. Don't worry, we'll wrap this up in 3 minutes. We just have this last question. So I'm going to say a lot of questions. I just wanted to give a summarized answer to everything because they look alike. Somebody is saying that for a group of people that just lost someone due to suicide, how can you help them so they don't end up being depressed? And somebody is similarly asking that somebody that is already mentally ill or depressed, what are the things that you can say to the person to avoid them from going on to suicide? And then during the course of Professor Akinselere's session, he mentioned that suicide does not take away the pain, it transfers it to someone else. So the person is asking that when somebody has suicidal thoughts, they're not thinking about other people, it's just about themselves. So why are we saying that they're transferring the pain to someone else? That's that question. And somebody that's already made up their mind to commit suicide, how can they stop the person? So just to summarize the answer.
It's difficult to summarize the answer to these questions because all of them have different answers. For instance, if someone has committed suicide and then they are surviving friends and relatives, how do we help them? Any loss can result in a reaction. And the reaction that's what we describe the reaction to loss is a grief reaction. Now, because that specific loss was due to suicide, it then complicates it further because sometimes part of the grief reaction may include a suicidal wish. And so that becomes a challenge. But in a previously healthy individual, in terms of mental health, that does not have pre-existing psychosocial issues, it is highly unlikely that it will be a problem. Many times, brief counseling just supports. Supportive, therapy or support. What do we mean by support? What are the things that they need to do urgently? Maybe they are unable to go to class, like Eunice talked about taking a break. If they need to take a break, and maybe they are not, they may not be in a position to tell the lecturer. Maybe if you are classmates, as soon as you get to class, please, sir, our class rep will not be available today. Little things like that you may not think as important. Maybe she's the one in charge of the projector of the class. And I say, don't worry about it. I will carry the projector to class for you. And anytime the lecturer asks, where is the class rep? You raise your hand. I'm here. You understand? Little things like that may be sufficient in a period of grief because, you need to give them sufficient time to grieve. If you force them out of that grief, you may be complicating, the situation. So let them grieve appropriately. And then most times, if there is no pre-existing condition, they will likely recover and get back to their previous level of function. Now, the most interesting question you asked is the one I'll answer next, is what do you do to a person that is determined to commit suicide? Now, there are different theories of why people become suicidal. If you are able to identify that the person has a mental disorder, treat it. If you treat it and it recovers from the mental disorder, yet the suicidality remains, probably because of ongoing difficulties, you try and see if you can resolve those difficulties, and those difficulties are impossible to resolve. It is not every suicidal person that you can help. There was a question they asked Professor Akinselere. He's not here anymore. And I'm happy I have the opportunity to also mention it. How do you, as a doctor, how do you cope with, is it failures or something like that? Setbacks. That is part of the setbacks. And one of the things that you should learn as a doctor, even whether you're going to do psychiatry or not, is that you must be able to have reasonable expectations. I do not expect that I will be able to help 100% of my patients. And if you know you are not going to be able to help 100% of your patients, what you need to do is make sure that you have done your best for every one of your patients. So if the patient is determined to commit suicide, you cannot follow him or her everywhere. If he has a mental disorder, treat it. If he has existing difficulties, if you can help him to seek help or whatever, direct them to care. Provide appropriate information. And then make your peace with, whatever outcome that comes from doing your best. So you cannot expect 100% success rate.
Thank you so much, sir.
I think there are two more, but I cannot remember if I've addressed them. Okay, transferring pain. That is true. Because he is experiencing the pain, but his loss is going to be pain for somebody else. But unfortunately, many times, those who are suicidal at that point are not thinking that way. And that is one of the tools you can use to help somebody who is suicidal. Part of what has been discovered is people who have a larger social network and who are closer to their social network are less likely to complete suicide than those who are not. So if you are fortunate to identify that, this individual who is suicidal has some significant others who he feels an attachment to, you could use that as a tool to help him or her to see that, are you aware that if you were to succeed with this your attempt, this pain has transferred to so and so person? That may be sufficient to change their mind regarding that suicidal intent. I had a patient like that. He was a man who was suicidal, who attempted suicide, and then he came to see me in the hospital. He was having difficulties. And then in the course of discussing, he was explaining how the difficulties are affecting his family and everything. And then, after listening to him, I then asked him, so what if you had succeeded? What will happen? He looked at me. I said, what will happen to, I mentioned the name of his son. He looked at me, he kept quiet. What will happen to, I mentioned the name of his daughter. He looked at me, he kept quiet. What will happen to your wife? He looked at me, he kept quiet. After a while, I noticed, you will see when he's already thinking, it never occurred to me. So sometimes that is a tool you can use to help that individual to seek a better coping mechanism.
Thank you so much, sir. Please, a round of applause for all our panelists. They've done a great job so far. Thank you so much. I hope we learned a lot, right? So this brings us to the end of the panel session. We'd like to take a photograph together before we go to the award presentation. A round of applause for all of us again. Thank you. Please, let's photograph her.
Okay, yes, we'll just do our award presentation now. Okay, thank you very much, everyone. So we'll be having the award presentation, then the vote of thanks, and we are done with the symposium. Okay, so I will have the honor and privilege of welcoming on stage again one of my teachers, Dr. Oluwafunbi Opadola, consultant psychiatrist, Lautech Teaching Hospital. So this is the TheStillWaters Mental Health Foundation Award of Appreciation presented to Dr. Oluwafunbi Opadola, consultant psychiatrist, Lautech Teaching Hospital, as panelist at the TheStillWaters Lautech Mental Health Summit on December 13, 2024. Thank you very much, sir. Thank you very much, sir. Okay, so the second award. So the second award is to another teacher and Oga. Will be presented to Dr. Olorunfemi Ogunwobi. Thank you very much, sir. We are so grateful. He had clinic today. He had to rush around and walk around it to be here. We are so grateful, sir. Thank you very much, sir. Okay, so for the other award presentation, I'll be welcoming Mrs. Oyewole to do us that pleasure.
This award is in appreciation of Dr. Faith Atewologun as panelist at the TheStillWaters Lautech Mental Health Summit on December 13th, 2024. This is to Miss Eno Eunice Obong, also a panelist at the Mental Health Summit.
Thank you.
Okay, so we'll be having the vote of thanks now. So can we have you, Ini? Please, let's give her a round of applause, please. She's put a lot of effort to making this program a success. So please, let's keep clapping, please, please, please. Thank you so much. Thank you very much.
Good day, everyone. Yeah. Thanks for your patience and thanks for your time. I'll be using this medium to appreciate everyone. Okay. Ladies and gentlemen, esteemed speakers, honored guests, and fellow advocates of mental health. As we come to the close of this remarkable mental health summit, I would like to take a moment to express my heartfelt gratitude to each and every one of you. So our incredible speakers, your expertise and your passion and your personal stories has inspired us, educated us, and motivated us to action. Your contribution has been invaluable and we are forever grateful. Thank you so much, sir. So our attendees, your presence here today demonstrates your commitment, prioritizing mental health and well-being. Your engagement and question and discussion has enriched our conversation and fostered a sense of community. To our organizers, volunteers, and supporters, your tireless effort has made this summit a reality, and your dedication to promoting mental health awareness and reducing stigma is truly commendable. Thank you, everyone. And to everyone who has shared their personal struggles and triumph with mental health, thank you for your courage and vulnerability. As we leave this summit, let us carry with the knowledge and inspiration of connection we have made. Let us continue to work together to promote mental health awareness, reduce stigma, and support those who are struggling. Thank you, everyone involved in making this mental health a success. May we continue to prioritize mental health and well-being, and may we create a world where everyone can thrive. Thank you, Dr. Sumishe. I really appreciate. Thank you. Special thanks to my unit member. I love you all. And special thanks to Adeniran Jesutoba and the LOC chairperson in name of Babalola Diana. Remember, the little we do is more. Thank you all.
Thank you so much. A round of applause for her.
Thank you all. Please do have a great day.
Thank you. I know we learned a lot, but please don't let it end here. The little we do is what? Is more. So go out there and do the more. And if you still have like pending questions, you can see our doctors before they go. You can walk up to them, greet them, and ask your questions. Thank you so much, everyone, for coming to this mental health symposium. Have a nice day. Bye.